One of the 10 most common cancers in both men and women is kidney cancer, and it typically strikes around age 64. Here to talk about one of the most common types of cancer there is oncologist Dr. Robert Figlin. He's of Cedars-Sinai Comprehensive Cancer Center. It's great having you, doctor.
Thank you for having me.
All right, so explain kidney cancer. Why is this the most common type of cancer?
So it's the most common cancer because it is a mass in the kidney. It arises starting in a small amount and becomes a nodule, a mass, and grows over time, months to years. 90% of patients with cancers in the kidney have this specific type, and ultimately it causes local symptoms in the form of discomfort, bleeding, or in some patients, no symptoms at all, and is found when the doctors are looking for something else.
Wow. Which thankfully they do come across it. Unfortunately, sometimes not soon enough. Well, why is it that older people are affected more?
I think it's mostly because cancer is a disease of aging, and that's not just for kidney cancer, but for many of the common types of cancer. Incidence goes up for breast cancer, lung cancer, colorectal cancer as well. Mm-hmm. It's most common in the 5th and 6th decade, but patients in their 20s and 90s can develop kidney cancer.
Wow. What are the risk factors involved?
So most patients don't have this list of risk factors that I'll share with you and have what's called sporadic kidney cancer. But some of the risk factors that are associated with kidney cancer are things like smoking, obesity, exposure to certain chemicals and industries, and a family history.
That seems like those are some of the common ones that you'd find with all cancers.
And in general, that's true.
Yeah.
I mean, this is a smoking-related malignancy, so stopping smoking and decreasing your smoking is always a good thing for many types of cancer.
Yeah, you never hear smoke more. Never a good fix to cancer. So how do you treat this, doctor?
So in local disease, it's surgically resected with great success. If it's spread beyond the local area by getting in the bloodstream and the lymphatics and travels to distant organs, it's treated with medication. And the interesting thing about medication is the science of the last several decades has allowed us to use targeted agents, and most recently what are called immuno-oncology agents, where we slow down the cancer, and for immuno-oncology agents have now resulted in prolongation of life, now 3, 4, and 5 years that wouldn't have been expected from therapies that were previously available.
That's pretty incredible. So progress is being made with the research when it comes to medicine.
Absolutely.
Where do you see the trajectory of this going? I mean, are we making enough headway where, I mean, obviously the goal is cure. Are we close? Are we getting there? I hope.
Yeah, so I think the goal is cure. I think that although some cancers can be made into a chronic disease,
yeah,
most patients would like to have their cancers disappear and not require any continued therapy and return to their normal lives. I think we're getting closer in kidney cancer because anytime we can start to influence the relationship between the cancer and the immune system, that offers us an opportunity to control the cancer differently than we can control with chemicals.
Awesome. If we want more information, where do we go?
So a couple places. nationalcancerinstitute.gov is a place to find out about clinical trials for kidney cancer. American Society of Clinical Oncology.org is an information system for the largest organization in the world, and obviously your regional cancer centers in your community and in your neighborhood.
All right, doctor, it's a pleasure. Thank you so much.
Thank you so much for having me. Have a great day.
You as well. It's a great reminder to stay healthy, make healthy lifestyle choices to help combat diseases like RCC. And to see this and past segments again, just head to our website, vegasmorningblend.com. And before